Question 1. Pet health and wellness monitoring. Which of the following is the most effective way to monitor the health of a pet during a pet sitting session? A. Only rely on the pet's appearance for signs of illness, such as lethargy or loss of appetite. B. Use the combination of monitoring physical health, observing behavior changes, and communicating regularly with the pet owner. C. Focus exclusively on the pet's grooming needs and ignore any behavioral or environmental changes. D. Conduct a thorough health check only if the pet starts showing severe signs of illness. Answer B. Explanation. Monitoring pet health involves a comprehensive approach which includes assessing both physical health, such as checking for signs of illness like vomiting or diarrhea, and behavioral changes, such as anxiety or lethargy. Regular communication with the pet owner is vital for understanding the pet's usual routine and behavior, making it easier to spot changes. Ignoring behavioral changes or grooming alone does not provide a complete picture of the pet's overall well-being. Waiting for severe symptoms to show before taking action can delay necessary care and affect the pet's recovery. Question 2. Scenario-based question. Mr. Robinson is pet sitting for a client who owns a dog that has a history of separation anxiety. Mr. Robinson has been asked to ensure the dog receives at least 2 30-minute walks a day with time for play in between. The first day, Mr. Robinson notices the dog becomes very anxious when left alone for even a short period. What should Mr. Robinson do to handle the situation effectively? A. Ignore the anxiety, as the dog is probably just adjusting to a new sitter and will calm down on its own. B. Immediately increase the frequency of walks and playtime, as more activity will help alleviate the anxiety. C. Follow the pet's routine as closely as possible, but reach out to the pet owner for guidance on how to manage the anxiety. D. Leave the dog alone for longer periods to let it get used to being by itself and become. Answer C. Explanation. Separation anxiety is a serious issue and requires a thoughtful approach. While increasing walks and playtime may help, it should not be the first step without understanding the specifics of the dog's condition. Mr. Robinson should follow the established routine as much as possible, which includes regular check-ins with the pet owner to ensure he is aware of any specific strategies they use to help manage the anxiety. Ignoring the issue. Trying to train the dog alone by leaving it alone for longer periods would likely escalate the problem, as the dog might become more stressed. Question 3. Legal and ethical standards. Which of the following is most important when creating a pet sitting contract with a client? A. The contract should include detailed information on the pet's medical history, but nothing about the pet sitter's liabilities. B. The contract should clarify the pet sitter's liability and any actions taken in emergency situations, as well as the pet owner's responsibilities. C. The contract should only focus on scheduling and payment details, ignoring liability or care procedures. D. The contract should have clauses allowing the pet sitter to changes to the pet's routine without consulting the pet owner. Answer B. Explanation. A well-rounded pet sitting contract is essential for protecting both the pet sitter and the pet owner. It must include detailed information about the sitter's responsibilities, including liabilities in case of emergencies such as accidents or health issues, and the owner's duties, such as providing clear instructions for medication or care routines. Liability clauses should cover potential injuries, property damage, or issues related to pet's health while under the sitter's care. The contract should not be one-sided or exclude critical elements, as this can lead to legal issues if something goes wrong. Question 4. Pet behavior and handling. Sarah is pet sitting for a dog that has shown signs of aggression towards strangers in the past. On the second day of her service, a delivery person arrives at the house and the dog begins to growl and bark aggressively. How should Sarah handle this situation, and what factors should she consider to ensure both the pet's safety and the safety of others? Sarah should immediately remove the dog from the area and keep it in a separate room to prevent any escalation, ensuring the delivery person is not in harm's way. B. Sarah should allow the dog to interact with the delivery person slowly to see if the dog's behavior changes, trusting that the dog will eventually calm down. C. Sarah should discipline the dog by using loud commands to stop the barking and growling, hoping to assert control over the situation. D. Sarah should ignore the situation, as the dog is just exhibiting normal territorial behavior and will calm down on its own without intervention. Answer A. Explanation. When handling aggressive behavior, it's important to prioritize safety. Sarah should avoid any confrontation with the dog and ensure the safety of the delivery person by removing the dog from the immediate area. Aggression is a serious issue, and while some dogs might exhibit territorial behavior, it's important not to allow the dog to interact with strangers without proper management. Sarah should also consider speaking with the pet owner. Understand if there are strategies in place for desensitizing the dog to such situations. Discipline through loud commands may escalate the dog's anxiety or aggression, and ignoring the situation would be irresponsible. Question 5. Animal species-specific care. Which of the following is a key consideration when caring for a pet rabbit in a pet sitting scenario, and why is it important? A. Keeping the rabbit in a small, confined cage with minimal space to prevent accidents. B. Providing the rabbit with a limited amount of lettuce as a primary food source for hydration and nutrition. C. Offering the rabbit a diet rich in hay and fresh water while providing enough space for exercise and movement. D. Allowing the rabbit to roam freely in an unsafe outdoor environment to encourage natural behavior. Answer C. Explanation. Rabbits require a specific type of care that differs from other pets. Their diet should be high in hay to support their digestive health, and they need access to fresh water. While they should have some space for exercise, it's important to provide an environment that is safe and secure to avoid injury. Providing too much lettuce can be harmful to their digestive system, and keeping them in small, confined spaces without exercise can lead to health problems like obesity. Rabbits should never be allowed to roam in an unsafe outdoor environment because they are vulnerable to predators and may escape. Question 6. Customer relations and communication. Megan is sitting for a cat that has had a history of urinary tract issues. The cat's owner has instructed Megan to monitor the cat's litter box and inform her if there are any signs of difficulty urinating. On day 2, Megan notices that the cat is urinating frequently and straining, which may indicate recurrence of the problem. What should Megan do to handle this situation, keeping both the pet's health and the owner's needs in mind? 8. Megan should immediately administer any medications the pet owner has left for the cat, regardless of the dosage instructions. B. Megan should call the owner to report the situation and ask for guidance on the next steps while keeping the cat comfortable until the owner provides further instructions. C. Megan should ignore the signs of distress, assuming the problem will resolve on its own, as frequent urination is not always cause for concern. D. Should take the cat to local veterinary clinic without consulting the owner, as she believes the issue is urgent. Answer B. Explanation. In situations where a pet's health may be at risk, communication with the pet owner is key. Megan should contact the owner immediately to inform them of the signs she has observed. The owner may have specific instructions on how to handle the situation, and it is important to follow them to ensure consistency in the pet's care. Administering medication without the owner's approval could lead to complications, and taking the cat to the without permission may result in unnecessary expenses or cause stress to the animal. Ignoring the issue would be irresponsible, as urinary tract issues in cats can quickly escalate into more serious health concerns. Question 7. Pet first aid and emergency procedures. During a pet sitting session, you notice that the dog has started limping after playing in the yard. Upon inspection, you discover a small cut on its paw, but the dog is not showing signs of extreme pain. How should you proceed in this situation to ensure the dog's well-being? A. Clean the wound with antiseptic and bandage it, but continue with normal activities and observe the dog for any further issues. B. Wait until the dog shows more signs of distress before taking any action, as the cut may be minor and could heal on its own. C. Immediately contact the pet owner to discuss the injury, providing details of the situation, and follow their guidance for treatment. D. Apply ice to the paw to reduce swelling and pain medication from your own supplies. Answer C. Explanation. When handling an injury, it's important to contact the pet owner for guidance, especially since they may have specific treatment plan in place for minor injuries. Even if the injury seems minor, it's essential to make sure the pet owner is aware of the situation and to follow their instructions. Applying antiseptic and bandaging the paw may be necessary, but the owner should always be consulted to ensure proper care. Waiting for the dog to show more signs of distress or attempting to medicate the dog without permission could lead to complications. Question 8. Safety and security. In a pet sitting scenario, you are responsible for 2 dogs from different households. One of the dogs has a history of resource guarding and shows aggression when food is present. How should you manage this situation to ensure safety and prevent conflicts? A. Allow both dogs to eat in the same room to prevent separation anxiety and ensure they both feel secure. B. Feed the dogs separately, ensuring each one has a quiet and safe space to eat without the possibility of food-related conflict. C. Allow both dogs to interact freely while feeding, as this will help them get used to each other's presence. D. Ignore the guarding behavior, assuming the dogs will figure out how to coexist peacefully feeding. Answer B. Explanation. Resource guarding, especially during feeding, can lead to aggressive behavior between pets. To prevent conflicts and ensure the safety of both dogs, it's crucial to feed them in separate areas where they can eat without the added stress of territorial aggression. Feeding the dogs together or allowing them to interact freely during mealtime can escalate tensions, especially if one dog is prone to guarding its food. Understanding each dog's behavior and managing the situation accordingly is essential for peaceful and safe pet sitting experience. Question 9. Pet sitting in special circumstances. Linda is pet sitting for a senior cat that has recently been diagnosed with arthritis. The cat is still mobile but has difficulty climbing onto furniture and may experience pain during certain movements. How should Linda approach the pet sitting care routine to accommodate the cat's special needs? A. Linda should encourage the cat to climb onto furniture to maintain its strength and mobility. B. Linda should ensure the cat's environment is adjusted to make movement easier, such as providing steps or ramps to access favorite spots and modifying the care routine to reduce excessive movement. C. Linda should limit the cat's movement entirely and keep it confined to one area to avoid any pain. D. Linda should increase the cat's physical activity if it causes some discomfort to keep it from becoming inactive. Answer B. Explanation. With senior pets, especially those with arthritis, it's essential to modify their environment to make it easier for them to move around without causing pain. Providing ramps or steps for the cat to reach favorite spots can help reduce strain on its joints. It is important to balance comfort with activity, but excessive restriction or forced movement can harm the cat. Encouraging normal behavior while ensuring the cat experience unnecessary discomfort is the most appropriate course of action. Question 10. Professional development. What is the most effective way for a professional pet sitter to maintain and enhance their skills and knowledge in the pet care industry? A. Relying on personal experience alone and not pursuing formal education or additional certifications. B. Continuously updating knowledge through online research and networking and pursuing relevant certifications to stay informed on best practices and industry standards. C. Only participating in informal workshops or discussions without engaging in formal educational programs. D. Focusing exclusively on practical experience rather than staying updated on new pet care techniques and trends. Answer B. Explanation. Ongoing education is vital for professionals in any field, and pet sitting is no exception. Pursuing certifications, attending workshops, and staying up to date with the latest research in animal care can ensure the pet sitter provides the highest level of care. Networking with other professionals can also help in gaining new insights and strategies. Relying solely on personal experience or informal sources may limit growth and the sitter from adopting new techniques that could improve pet care and safety. Question 11. Recognizing pet behavior. Tom is caring for a pet rabbit that has been acting more withdrawn than usual. The rabbit is not eating its usual amount of food, and its fur appears slightly matted. What could be the most likely cause of these symptoms, and how should Tom handle the situation? A. The rabbit is likely stressed due to being in a new environment, and Tom should give the rabbit some time to adjust before taking any further action. B. The rabbit may be ill, and Tom should immediately seek veterinary care to rule out any serious health issues such as gastrointestinal stasis or a dental problem. C. The rabbit's behavior is normal and simply a sign of aging, so Tom should continue to monitor the situation but intervention. D. The rabbit is likely just bored, and Tom should provide more toys and stimulation to improve its mood. Answer B. Explanation. Changes in a rabbit's behavior, such as decreased appetite and matted fur, can indicate health issues such as gastrointestinal stasis or dental problems. These issues require prompt attention from a veterinarian. While stress from being in a new environment may contribute to the rabbit's behavior, it is crucial to prioritize the rabbit's health and seek professional help. Boredom alone would not explain the physical signs. Aging-related changes would not typically cause such rapid behavioral shifts. Question 12. Managing multi-pet households. Sarah is pet sitting for a family with 2 cats and a dog. The dog and 1 cat get along well, but the second cat tends to be more territorial and doesn't like the dog. During Sarah's visit, the territorial cat seems agitated whenever the dog is around. How should Sarah manage this situation to ensure the safety and comfort of all pets involved? A. Sarah should separate the dog and the territorial cat when the dog is inside the house, allowing them to have their own space to avoid stress. B. Sarah should force the territorial cat and the dog to interact to help them get accustomed to each other. C. Sarah should ignore the territorial cat's behavior and let the pets figure things out themselves, as they will likely calm down eventually. D. Sarah should remove the territorial cat from the house and place it in to prevent any potential conflict with the dog. Answer A. Explanation. It is important to respect the territorial cat's boundaries. Separating the dog and the territorial cat when necessary can reduce stress and prevent potential conflict. Forcing interaction or ignoring the behavior may escalate aggression and create dangerous situation for both the dog and the cat. Removing the cat from the environment completely may not be necessary unless there is an immediate safety concern. Managing the space, providing individual attention to each pet can promote peaceful atmosphere. Question 13. First aid for pets. Lily notices that her client's dog has small but deep cut on its leg while playing outside. The dog is not limping or acting distressed, but the cut is bleeding slightly. How should Lily proceed in handling this injury? A. Lily should immediately clean the wound with antiseptic and apply bandage, ensuring the dog's wound is properly covered to prevent infection. B. Lily should wait for the dog to show signs of distress before taking any action, as minor cuts often heal on their own. C. Lily should apply ice to the wound to reduce swelling and take the dog to the vet as precaution, even though it is not visibly distressed. D. Lily should clean the wound and apply pressure to stop bleeding, but she should not use any antiseptics, assuming the wound will naturally heal without medical intervention. Answer A. Explanation. For minor cuts, cleaning the wound with antiseptic and applying a bandage is an appropriate first aid step. This can help prevent infection and protect the wound from further contamination. Even if the dog is not limping or visibly distressed, it's important to care for the injury right away. Waiting for distress signs or not using antiseptic can lead to complications. Applying ice or immediately seeking veterinary care might be necessary only for more severe injuries or in cases of excessive swelling. Question 14. Special needs pets. Emily is caring for a senior dog that has recently been diagnosed with cataracts. The dog has become more cautious when navigating around the house and occasionally bumps into furniture. How should Emily ensure the dog's safety while still maintaining its routine? A. Emily should move the dog's furniture around to create clear pathways and avoid rearranging the dog's routine, as it could help the dog adjust to its vision loss. B. Emily should limit the dog's movements around the house and avoid letting it walk freely to prevent injury. C. Emily should ensure the dog has consistent routine, keep the environment clear of obstacles, and use commands to guide it, allowing the dog to navigate as normally as possible. Emily should consult veterinarian about potential treatments or surgical options for the cataracts before making any changes to the dog's environment. Answer C. Explanation. While it's important to make adjustments for dog with cataracts, the goal is to maintain as much normalcy as possible for the dog's mental and physical well-being. By ensuring that the environment is free from obstacles and providing verbal cues, Emily can help the dog safely navigate its surroundings. Limiting the dog's movements or drastically altering its routine can create unnecessary stress. Consulting veterinarian is good, but the primary focus should be on safety and comfort in the short term. Question 15. Pet transportation during a pet sitting assignment. You need to transport a dog to the vet for an emergency. The dog is anxious in the car and you are concerned about its well-being during the journey. What is the most effective way to manage the dog's anxiety and ensure safe transportation? A. Allow the dog to roam freely in the back seat during the trip to reduce its stress and let it feel less confined. B. Use a well-fitted pet carrier or seat belt harness to secure the dog safely during transportation and ensure the dog's comfort. C. Ignore the dog's anxiety, assuming that the ride will be short and the dog will settle down on its own. D. Give the dog calming medication without consulting the owner to prevent excessive anxiety. Answer B. Explanation. Using a pet carrier or seat belt harness ensures that the dog is safely secured during the ride, which is crucial for both the dog's safety and yours. These measures can also help reduce anxiety by limiting the dog's ability to move around and creating a more stable environment. Allowing the dog to roam freely in the car is dangerous and could lead to distractions. Giving calming medication should always be done with the owners, and ignoring the dog's anxiety could escalate the situation. Question 16. Monitoring pet health. Jane is caring for A cat with a sensitive stomach. The cat has been eating its regular food but has started vomiting more frequently. Jane notices that the cat seems lethargic and not as interactive as usual. How should Jane proceed to ensure the cat's health is properly addressed? A. Jane should continue to monitor the cat's behavior for a few more days, as the vomiting may be a result of minor issue that will resolve on its own. B. Jane should change the cat's diet to something more bland, such as boiled chicken or rice, and continue to monitor the situation. C. Jane should contact the pet owner immediately to report the symptoms and seek guidance on whether vet visit is necessary. D. Jane should administer an over-the anti-nausea medication to the cat, assuming the vomiting is caused by minor digestive upset. Answer C. Explanation. Vomiting, lethargy, and changes in behavior in a cat could be indicative of an underlying health issue that requires veterinary attention. Jane should reach out to the pet owner to inform them of the situation and follow any specific instructions they may have. The cat's symptoms could point to more serious issues such as an infection or digestive disorder that needs professional care. Changing the diet or administering medication, consulting the owner may not address the underlying cause and could make the problem worse. Question 17. Pet comfort and environment. Mike is caring for a dog with separation anxiety. The dog becomes destructive whenever Mike leaves the room, chewing furniture and barking excessively. What steps should Mike take to help manage the dog's anxiety and prevent damage to the house? A. Mike should leave the dog alone for longer periods to help it get used to being by itself. B. Mike should implement a consistent routine with positive reinforcement for calm behavior, provide the dog with engaging toys, and consider creating a safe space for the dog during his absences. C. Mike should use a harsh reprimand when the dog behaves destructively to discourage the behavior. D. Mike should ignore the anxiety entirely, assume the dog will eventually stop acting out on its own. Answer B. Explanation. Separation anxiety is best managed by implementing a consistent routine that includes positive reinforcement for calm behavior. Providing the dog with engaging toys or treats can distract it from destructive behaviors. A safe space, such as a crate or designated area, can help the dog feel secure. Leaving the dog alone for extended periods may increase anxiety, and harsh reprimands are counterproductive as they increase stress. Ignoring the behavior is also not effective, as it can allow the anxiety to worsen. Question 18. Pet behavior modification. Rachel is pet sitting a dog with a history of jumping up on people, especially guests who arrive at the home. The dog's owner has asked Rachel to work on modifying this behavior during the visit. How should Rachel approach this challenge? A. Rachel should reinforce the jumping behavior by giving the dog attention and affection when it jumps, as this might help the dog feel more comfortable. B. Rachel should consistently ignore the jumping behavior and only give the dog attention when it remains calm, reinforcing calmness over excitement. C. Rachel should physically restrain the dog whenever it jumps and immediately provide a treat as a reward for staying on the ground. D. Rachel reprimand the dog sharply when it jumps and provide verbal corrections to discourage the behavior. Answer B. Explanation. Ignoring the jumping behavior and only providing attention when the dog remains calm is a fundamental technique in behavior modification. This method helps the dog understand that calm behavior is rewarded, while jumping does not result in attention. Giving attention to the dog while it jumps can inadvertently reinforce the undesirable behavior. Physically restraining the dog or reprimanding it may escalate anxiety and making the behavior worse. Question 19. Understanding pet communication. Emma is watching a dog that has been barking incessantly every time someone leaves the room. The dog seems to be stressed and follows Emma around the house. How should Emma interpret this behavior, and what steps can she take to alleviate it? A. The dog is simply being protective and should be allowed to continue following Emma to ensure it feels secure. B. The dog is displaying signs of separation anxiety, and Emma should implement gradual desensitization techniques by leaving and returning at short intervals, rewarding calm behavior. C. The dog is simply seeking attention and should be ignored until it becomes quiet to discourage the barking. D. The dog is being dominant and needs discipline to stop the behavior. Answer B. Explanation. Separation anxiety is a common reason for the behavior described. Gradual desensitization, leaving and returning for short periods of time while rewarding calm behavior, can help the dog build confidence and reduce anxiety. Allowing the dog to follow Emma around or ignoring the barking could reinforce the behavior. Discipline for this type of anxiety is not appropriate, as it is a psychological issue, not an attempt to dominate. Question 20. Handling aggressive behavior in pets. Laura is pet sitting for A dog that has recently started showing signs of aggression towards strangers, particularly during walks. The dog growls and barks when people approach. How should Laura handle this situation to ensure the safety of everyone involved? A. Laura should ignore the behavior and assume the dog will eventually calm down once it gets used to the new environment. B. Laura should use a firm command to reprimand the dog every time it barks at a stranger and continue walking as usual. C. Laura should remain calm and use positive reinforcement to reward the dog for calm behavior, keeping a safe distance from strangers and possibly using a muzzle if necessary. D. Laura, avoid taking the dog on walks until the behavior stops, as it could be dangerous for both her and the dog. Answer C. Explanation. Aggressive behavior towards strangers is often a sign of fear or territoriality, and reprimanding the dog could escalate the anxiety or aggression. Remaining calm, using positive reinforcement for calm behavior, and keeping a safe distance from strangers can help the dog gradually learn to behave better. If necessary, a muzzle can be used to prevent biting during walks, but it should be a temporary solution while the behavior is being modified. Ignoring or avoiding the situation will not address the underlying issue. Question 21. Safe playtime for pets. When pet sitting, a high-energy dog, John notices that the dog gets overly excited during play and starts chasing after everything, including cars and bicycles. What steps should John take to ensure safe playtime without encouraging dangerous behavior? A. John should let the dog chase after anything it likes to burn off energy, as this is part of the dog's natural behavior. B. John should engage the dog in control play, such as fetch with a ball, and discourage chasing anything that could be dangerous. C. John should restrict playtime to only indoors, as playing outside could expose the dog to risky situations like traffic. D. John should physically restrain the dog from chasing anything and verbal commands to stop it mid-chase. Answer B. Explanation. While it's natural for dogs to chase moving objects, allowing the dog to chase cars or bicycles can be dangerous. Control play, such as fetch, allows the dog to burn off energy safely while learning appropriate boundaries. Restricting play to indoors or using physical restraint alone may not address the underlying behavior and could limit the dog's opportunities for healthy exercise. Verbal commands can help, but it's to provide structured and safe outlets for the dog's energy. Question 22. Feeding pet recommendations. Catherine is pet sitting for a cat with a sensitive stomach. The cat's owner instructed Catherine to feed the cat specific brand of food, but the cat has refused to eat it for the past 2 days. What should Catherine do to ensure the cat is eating properly and staying healthy? A. Catherine should try switching to different brand of food to get the cat to eat, as the current food might not be to the cat's liking. B. Catherine should contact the pet owner to discuss the situation and ask if the cat has any dietary preferences or specific feeding guidelines. C. Catherine should withhold food from the cat for a day to encourage it to eat the current food when it gets hungry. D. Catherine should ignore the situation, as the cat will eventually, once it gets hungry enough. Answer B. Explanation. It's important to communicate with the pet owner before making any changes to the cat's diet. The cat may have specific dietary preferences or health issues that need to be addressed. Simply switching food without consulting the owner could upset the cat's stomach further. Withholding food or ignoring the situation could lead to health issues like dehydration or malnutrition. The best course of action is to discuss the problem with the owner. Explore other feeding options if needed. Question 23. Handling special dietary needs. Steve is caring for a dog that has a special dietary requirement due to a food allergy. The dog's owner has provided Steve with specific instructions, but Steve notices the dog has eaten some table scraps while the owner is away. What is the best course of action for Steve? A. Steve should immediately contact the owner to report the situation and ask if any corrective actions are needed, including monitoring for allergic reactions. B. Steve should wait until the dog shows signs of an allergic reaction before taking any action. C. Steve should simply let the dog continue eating whatever it wants, as food allergies aren't typically serious. D. Steve should give the dog extra food to counteract any potential allergy-related issues caused by the table scraps. Answer A. Explanation. Food allergies in pets can lead to serious reactions such as vomiting, diarrhea, or more severe symptoms. It is important to contact the pet owner immediately to report the situation and follow their instructions for managing the dog's health. Waiting for symptoms to appear could lead to unnecessary complications, and giving extra food may not address the allergy issue. The best action is to communicate with the owner and monitor for any signs of distress. Question 24. Managing multiple pets with different needs. Anna is pet sitting for a family with multiple pets, including 2 cats, a dog, and a hamster. Each pet has different needs and temperaments. What steps should Anna take to manage the pets effectively and ensure everyone is comfortable and safe? A. Anna should treat all the pets the same way, giving them equal attention and care without making adjustments for individual needs. B. Anna should follow the pet owner's specific instructions for each pet, paying attention to their individual personalities and needs and creating routine that accommodates everyone. C. Anna should focus mostly on the dog, as dogs are typically the most demanding pets, and give less attention to the cats and hamster. D. Should let the pets interact freely to see how they get along, only intervening if any fights or issues arise. Answer. B. Explanation. Each pet has its own personality, needs, and preferences, which should be taken into account when caring for them. Following the pet owner's instructions for each pet and providing tailored attention ensures that their individual needs are met, creating a comfortable environment for all. Ignoring these needs or focusing too much on one pet could lead to stress or dissatisfaction among the others. Managing the pet's care effectively requires flexibility and attention to their unique characteristics. Question 25. Understanding pet play and socialization. Katie is pet sitting for a puppy that has never been around other animals before. The puppy becomes nervous and shows signs of fear whenever it is introduced to other pets. How should Katie help the puppy adjust and ensure it develops good socialization skills? A. Katie should avoid introducing the puppy to other animals entirely, as it could be too overwhelming and stressful for the puppy. B. Katie should slowly introduce the puppy to other pets in controlled environments, rewarding calm behavior and offering plenty of positive reinforcement during the interactions. C. Katie should force the puppy to interact with the other animals, as this will teach it how to socialize quickly. D. Katie should allow the puppy to decide whether it wants to interact with other pets, assuming it will naturally adjust when it feels ready. Answer. B. Explanation. Socializing a puppy with other animals should be done gradually and in controlled environments to prevent overwhelming the puppy. Positive reinforcement for calm behavior will help the puppy associate social interactions with positive experiences. Forcing interaction can increase fear and anxiety, hindering the puppy's ability to socialize effectively. Allowing the puppy to decide might delay socialization and result in missed opportunities for healthy development. Question 26. Dealing with pet anxiety. Jennifer is pet sitting for a dog that experiences separation anxiety whenever the owner leaves. The dog barks and becomes destructive. What strategy should Jennifer implement to help manage the dog's anxiety during her visits? A. Jennifer should ignore the dog's anxiety and assume it will calm down over time without intervention. B. Jennifer should leave the dog alone for extended periods to help it get used to being by itself. C. Jennifer should implement calming routines such as leaving the dog with an item of the owner's clothing, providing distraction toys, and using positive reinforcement when the dog remains calm. D. Jennifer should reprimand the dog for barking destructive behavior to show it that such actions are not acceptable. Answer. C. Explanation. Separation anxiety is best managed by providing consistent, calming routines and offering distractions such as toys or items that smell like the owner to comfort the dog. Positive reinforcement for calm behavior will help the dog learn to associate being left alone with rewards. Ignoring the behavior or reprimanding the dog can increase anxiety and reinforce undesirable behaviors. Leaving the dog alone for extended periods without addressing its anxiety may worsen the problem. Question 27. Pet illness recognition. During her pet sitting assignment, Emily notices that the dog is lethargic, has a decreased appetite, and seems to be drinking more water than usual. What could these signs indicate, and what should Emily do next? A. These signs are likely normal for an older dog, and Emily should just monitor the situation for a few more days. B. The dog could be showing signs of illness, such as diabetes or kidney disease, and Emily should immediately contact the pet owner to report the symptoms and ask for further guidance. C. The dog is probably just stressed due to being in a new environment, so Emily should try to calm the dog and continue with the normal routine. D. These symptoms are likely caused by a dietary change, so Emily should adjust the dog's food and see if it improves. Answer. B. Explanation. Changes in appetite, increased thirst, and lethargy can be signs of underlying health problems such as diabetes or kidney disease, which require professional attention. Emily should contact the pet owner to report the symptoms and ask for further guidance, as the situation could be urgent. Simply assuming the behavior is related to stress or diet without consulting the owner or a veterinarian could put the dog's health at risk. Question 20. Proper pet hygiene. Sarah is pet sitting for A cat that has been scratching excessively around its ears and neck. Upon inspection, Sarah notices some redness and irritation in these areas. What should Sarah do to address the cat's discomfort? A. Sarah should ignore the issue and assume the cat is just grooming excessively due to stress. B. Sarah should clean the cat's ears and neck with water and apply an over-the-counter ointment without consulting the owner. C. Sarah should contact the owner immediately to discuss the symptoms and ask if the cat has any known allergies or sensitivities before attempting any treatments. D. Sarah should attempt to treat the cat's irritation with topical medication or flea treatment, assuming the issue is related to fleas. Answer: C. Explanation. Redness and irritation around the ears and neck could indicate an allergic reaction, skin infection, or other medical issue, such as flea infestations. Before taking any action, Sarah should contact the owner to discuss the symptoms and follow their advice. Applying treatment without the owner's consent or veterinarian's guidance could make the situation worse or cause further harm. Ignoring the symptoms could lead to the cat experiencing unnecessary discomfort or worsening the condition. Consulting the owner ensures that any treatment plan is in line with the cat's medical history and any previous conditions it may have had. Question 29. Pet sitter's liability in an emergency situation. Tom is pet sitting for a dog that is known to have a medical condition requiring daily medication. One evening, the dog appears to be in distress, and Tom realizes he missed administering the medication earlier that day. What should Tom do in this situation? A. Tom should immediately give the dog its missed medication, regardless of the timing, and wait to see if the dog improves. B. Tom should ignore the situation, assuming that a missed dose will not cause any serious issues. C. Tom should contact the pet owner immediately to report the situation and ask for advice on how to proceed. D. Tom should take the dog to the nearest veterinary clinic without consulting the owner, as he believes the situation may be urgent. Answer: C. Explanation. When a pet has a medical condition, it's crucial to follow the owner's specific instructions regarding medication. If Tom misses dose, the first step should be to contact the pet owner and inform them of the situation. The owner can then provide advice on whether to administer the missed dose, adjust the schedule, or seek veterinary assistance. Acting without consulting the owner could lead to the dog receiving incorrect treatment. In emergency cases, it is essential to act in consultation with the pet owner and medical professionals. Question 30. Preventing infections during pet sitting. During a pet sitting assignment, Kate notices that the dog's paws are frequently wet and the dog seems to be licking its paws constantly. What should Kate do to prevent potential infections or health issues? A. Kate should ignore the licking behavior, as it is just a sign that the dog is cleaning itself. B. Kate should clean the dog's paws regularly to remove any dirt or moisture, especially after walks, and monitor for signs of irritation or infection. C. Kate should apply antifungal cream to the dog's paws to prevent infections. D. Kate should limit outdoor activity for the dog to avoid the risk of infection. Answer: B. Explanation. Constant licking and wet paws could be indicative of potential issues such as paw irritation, fungal infections, or allergies. Kate should regularly clean the dog's paws, especially after walks, to ensure they are free of dirt and moisture that can lead to infections. Monitoring for signs of infection, redness, swelling, or odor is also important. Applying medication without consulting the pet owner or veterinarian is not recommended. Unless specifically directed, limiting outdoor activity is not necessary unless the paw issue becomes more severe.